Well, thank you all for taking the time to sit and join us today. This is very much a continuation of the two previous speakers, with a slight tilt towards public health. So, as Adam said, I work for LUC, Landscape Architects. We deliver a lot of different kinds of projects on a lot of different scales, and we've been listening very carefully to the health and well-being debates that have been going on and realizing how central so much of what we've been doing for the last 50 years is in terms of delivering better health and well-being for people. So we have started doing an internal assessment tool, which I will talk about briefly. The public health element of this really is to say that it's already been touched on, but there is so much urbanization going on, so much intensification. The pockets of green space that are left have to perform more and more functions simultaneously. They have to do all the green infrastructure and SUDs, but they also have to provide amenity, and they also need to try to combat some of the really scary health issues that we are having globally and in the UK. So I've been going to a lot of conferences with a specifically looking at health, and hearing doctors say if we could only turn walking into a pill, everyone would think it was the miracle drug. The great thing about trying to value landscape and well-designed, well-placed landscape is that there's a huge amount of work going on gathering evidence. So we can use that evidence to support the projects that we're trying to do. We just need to connect the dots in a lot of cases. I just yesterday read a new one, which is Danish research that says that you're 55% less likely to develop a mental disorder in adulthood if you grow up in greener surroundings. And it took other risk factors into account, so that's actually aside from issues like different levels of social deprivation. Which brings me to this quote here, which I've spoken about previously, but it says, I'll read it, populations that are exposed to the greenest environments also have lowest levels of health inequality related to income deprivation. Physical environments that promote good health might be important to reduce socioeconomic health inequalities. I think this is a really powerful truth, and there's more and more evidence supporting this. Rising health inequalities, the statistics are dreadful all over the UK, and what we can't do is trying to find solutions to all these complex health problems. They're very complicated problems. The solutions are complicated. But public space is public space. It's democratic. If we can bring to the most sort of socially deprived, economically deprived areas high quality green space and give people reason to step outside their homes, somewhere, a nice tree to sit underneath on a bench, they've got to walk there, they'll walk back. It can also, it can start tapping into that miracle drug idea. And we've got to have these public spaces. We've already got them, but some of them are in terrible condition. So I just think there's a lot of joining up of dots that we can do to provide some not that expensive or difficult solutions, which will just help. They're not going to solve all of these massive global issues in one go, but they're within our ken to control. I'm going to talk very briefly about this project that we've been doing up in Glasgow, which looks like this. You're looking from the top of a disused clay pit, Between the Green and Glasgow City, there's a backwater canal. This piece of space was derelict and fenced off. It's now a local nature reserve. That transformation happened because initially people in the community so those plans there show there are three of the most socioeconomically deprived neighbourhoods of Glasgow City, and that's saying something, are around that triangle. They couldn't get into that green space, and they couldn't get to each other, and they couldn't get to Glasgow city centre without going all the way around. Most of them don't have car ownership. There aren't many bus services, and to get to anything that looked like that, you'd have to drive 20 minutes out of town or take a bus. So they've got that now on their doorstep. This slide is there to remind me to say the most important thing about projects like this being successful, and previous speakers have touched on it, is community engagement. And this was a 3-day design process that we went through with the local community. And it's important to say here that the very first workshop that was done to turn this piece of neglected land into a nature park was done just by the locals. There was no professional consultants involved. We were brought on board later, and those local champions are critical. Finding them and getting them on board are critical to making these things successful. So that's just what came out of the charrette. You can just see there's the water running through. We're putting some bridges, we're putting some paths, making connections. And now these people have access to this, and there are all kinds of initiatives and programming that will come onto the back of it. In terms of measuring, we are just at the moment simply putting counters to get numbers for the number of people that are accessing this space, but we want to take it much further than that. Which brings me to how we started thinking about measuring. LUC does a lot of play projects, and we started with the Princess Diana Memorial Playground in Kensington Gardens over 20 years ago. And so children's play and the critical importance of that in terms of their development has always been a very important part of what we do. But now we were starting to see the serious health implications for not getting children outside playing. This slide is to go with the horrifying words that in the UK, the average child now spends less time outdoors than our prison inmates. There are a lot of reasons for that. This goes back to what Adam was saying, as does this slide. I have a 17-year-old boy. I know how many people, 17-year-olds, lost their lives just this past weekend by being outside. So it's complicated. This is our flagship play project in the Olympic Park. Flagship to us because we were able to we had a really great client that was prepared to take risks. We've sort of, over the years, boiled down our play design into 3 critical elements that are written on that slide. We know in a really profound way now, personally as designers, that those 3 things, designing from the child's experience, providing contact with nature, and allowing children to have autonomy, risk and challenge, that's what we need for to get healthy adults, and healthy in so many ways. People need the chance to become independent in a not too terrifying place. These are just some images from that play space. And I can't remember what it was I was going to say when I came on, so I shall check my notes. Oh yeah, so we were starting to think seriously about how could we measure the impacts that these places that we felt as designers were doing really important things. How can we measure impact so that our clients or potential clients could get funding? What kind of evidence, what kind of questions would we ask? So much of this stuff is kind of intangible. Although, as I was saying, the evidence base out there that other scientific researchers are bringing in is hugely helpful, and we can say, okay, we have provided this much X and Y, and we can connect that to these studies. So we're doing some of that, but we wanted to do something that was also more kind of qualitative. This slide's there because of the importance of producing play that means that children have to collaborate. This is our sand and water area at Tumbling Bay still. Those are my children. They always seem to end up in the shows. I don't know how. But this is showing how important it is to have non-prescriptive play where you can manipulate sand and water, rocks, and do it how you want, turn it into whatever you want it to. When we did this project a couple of years back with Camden, they wanted us to put playgrounds into schools in Camden, specifically because they had concerns over rising child obesity. This was the first time we'd been asked as landscape architects to do a project that had an outcome of we want these kids to move more. We want higher physical activity levels, and we are going to actually put things on them, a very scientific phrase, things that will count how much they move before and after. And it had funding from the NHS through the clinical commissioning groups. And this got us to thinking, right, okay, the NHS is starting, Public Health England, they're starting to think, ooh, maybe we need to get to some of these problems earlier in the chain. We certainly can't afford to keep on fixing the problem once it's already there. So we did our process of engaging with the children, designing the spaces with them. And in some ways, these play spaces themselves are nothing particularly special. They are small budgets, done quickly, giving kids reasons to stretch and move in their what was once tarmac, just flat tarmac. But what was new for us, I suppose, was this urgency, a political urgency, to get children moving. So that must be nearly out of time. 2 minutes, perfect. What we're doing at LUC is we're calling it a monitoring and assessment tool for the health and well-being impacts of our play projects, and it combines 4 different elements. It combines questionnaires for the carers so that they can give their self-reported opinions of the space. Some numbers, so simple stuff like how many people were there. So what we do, is we go twice before we redesign a play space, and then we go twice again a year later and try and hit the same times. We do observational studies, and we look at what the children are doing and how they're playing. And because we're trying to measure health and well-being impacts, and that's such a big sort of fluffy catch-all phrase, it's been a very interesting process trying to determine exactly what the indicators should be. And we're still evolving it, to be fair. But they are things like, are they interacting with nature? Are they playing with other children? How long are they staying for? Are their parents talking to other people? We want to expand it, and we're starting to include, because we think that these sorts of natural play areas, if they're in the right place, can be catalysts for greater community activation. And so then we would like to have a look at how many maybe people who haven't brought kids to the playground are sitting nearby on benches, hanging out and combating the social isolation problems that we have, which are growing as well in our country. So that's the journey that we're on. We're excited because some of our long-term clients, like the Royal Parks, this is in Greenwich, I think, Greenwich Park, are now hiring us because some of the funding bodies, like London Marathon Trust, ask for monitoring evaluation as part of their outputs, as part of what they get from, what you give back from getting their money. So we're working with the Royal Parks and with Peabody Social Housing to help them to create these measurements. So it's really an ongoing process, and I'd be very interested to hear what other people's thoughts are on how best to do this. And I think that the evidence changes. The evidence that's needed changes depending on who the audience is. Different bodies want different kinds of numbers or quotes, and maybe sometimes the politicians are better off with a video clip of a family, and the NHS want a 10-year longitudinal scientific-based study, which independent designers can't afford to do. So it's finding the middle ground and working things out for the people that need them. Thank you.